Thank you, Mr. Chairman. Thank you for your testimony. What percentage of funding for Planned Parenthood of Greater Ohio comes from the state of Ohio?
I don't have that number offhand. I can get that to you. It depends if you're talking about educational services or our greater financial landscape. We are a Title X recipient, which we get from the federal government, but the dollar amount in this legislation would affect about $600,000 of educational and outreach programming. And that's not to speak of how it would affect our participation in the infertility prevention project and what that would mean for us.
Thank you, Mr. Chairman. So do you know what the 600,000 out of, do you know what the total percentage or total dollar amount that would be affected within that specific program?
Sure, I'm sorry. I believe it's about 1.3 million. I can give you exact figures if you'd like.
That would be great.
Sure.
Follow up, Mr. Chairman? Sure. I'd now like to talk about federally qualified health centers and the difference between Planned Parenthood and FQHCs. The National Association of Community Health Centers states that there are 204 FQHC service sites in Ohio as opposed to the 28 Planned Parenthood centers. And the FQHCs serve 508,333 individuals per year in Ohio on an average basis. And so could you describe to me, I guess, how would there be a public health crisis in the state of Ohio if Planned Parenthood would be defunded when there are 204 FQHCs in many counties as opposed to 28 Planned Parenthoods?
Sure, that's an excellent question, thank you. So on the list of FQHCs, a lot of those providers don't do reproductive health care. They don't offer the same range of reproductive health care we offer. There's some providers that have a 3 to 6 week wait time. We think if someone's in a health crisis, if they need an HIV test, if they're having symptoms of some sort of infection, we want to see them as soon as possible. There is a list I read when I was here a few weeks ago in the Senate of alternative healthcare providers and where people could go instead of Planned Parenthood, and that list included dentists, optometrists, elementary school nurses, and other healthcare providers that in no way provide reproductive healthcare or education.
Thank you, Chairman, and thank the witness for being here. Ms. Novak, were you here for the pro bono testimony hearings? Were you in the audience?
I was not.
So during many of the pro bono testimony, there were several witnesses who testified that there was a culture at Planned Parenthood where it was sort of, let's just